Okay, so thank you. We have an opportunity today now to talk through some of the aspects of the discipline of adult nursing. We're very fortunate to have a number of people from the adult nursing field with us today. I've got Monica Donovan, who's our professional lead for adult nursing in the School of Nursing and Midwifery. We also have William Mundy, who is an advanced nursing practitioner here in Northern Ireland. And we also have William Somerville and Emily Sinclair, who are second year adult nursing students. So thank you so much for joining us just for a couple of minutes to talk through your discipline. Uh, so I guess the first question I'm going to pick on is maybe I'll go with Monica for this one. Is maybe could you tell me a little bit about? Obviously, we have a number of disciplines that are taught within the School of Nursing Midwifery. I'm wondering if you could tell us a little bit about what is it that makes adult nursing unique compared to maybe some of the other disciplines that we do have.
Yes, thank you, Matt. So my name is Monica Donovan. I'm professional lead for adult nursing here at the School of Nursing and Midwifery. And yes, there are many core elements that go across all fields of nursing. But I think for adult nursing, we're in a privileged position because we get to support people through the whole trajectory of adulthood. So that could be anything from a 17-year-old right through to somebody who's frail and elderly. So you could be, I know even from my own experience, I cared for young adults who were receiving chemotherapy for cancers. That could be through to somebody who's living with diabetes, and then of course the frail and elderly person who's at the other end of adulthood. I think for adult nursing as well is that it's such a diverse scope of practice. So there are so many opportunities. You could work in anything from oncology, cardiology, endocrinology. I mean, we could go on and on and on. So when there's this sort of myth out there that there's, the general nursing, there's nothing general about adult nursing. So adult nursing encompasses many specialities, and if you become an adult nurse, you'll have the opportunity to work within one of those specialities, which some of the folk on the call will talk about in a little bit later. And most importantly, in adult nursing, you're in a privileged position to really make a difference to people's lives, regardless of where they are, because any person really who uses the health service is vulnerable. And you have that unique position to really make a difference, because adult nurses really are at the heart of healthcare.
That's terrific. And so maybe Emily, was there anything in particular that sort of attracted you to this specific discipline over maybe some of the others?
Definitely. I come from the perspective of mature students. I'm 27, and so I feel like for me, I come from a background of whenever I finished university, or the first time in 2016, I did art. And then what really drew me to nursing was my grandparents became quite unwell, and we wanted to facilitate them staying at home. And we had the acute care at home team, which were great. They're an in-home community team that can come out. So there's, and my mum's a nurse as well, but I am also a dyslexic person who has dyslexia. So I always felt like nursing wasn't just something that I could do. I just didn't think that it was something that I was able to do. But then whenever we had the acute care at home team out to help my grandmother try and get better, I was really interested in her care, everything about her care, her skin, what the news chart was, what her, everything to do with how to get her to get better. And Dr. Bryson, he said, whenever he was asking for an update on how she'd been overnight, he said, "Are you medical? Are you a nurse? What are you doing?" I said, "No, I'm not." And I, just felt like, why couldn't I do that? Why couldn't I do that role? What is stopping me from doing that? And I'm sure there's many students who probably think the same thing who are a bit older. I can't, that's not something I could do for X, Y, and Z, but it's, why couldn't you do that? Of course you could. So I think for adult nursing, the real, thing that pushed me towards it was, the feeling of accomplishment and just like the good feeling that you get for caring for somebody and just helping them to get better. Even with somebody who is older, you're trying to help them and, help somebody who can't help themselves, really.
Very good. And you've hit on something that I guess is kind of common to some of the other disciplines as well, when somebody gets a passion for it. But it's interesting, and I'd like your opinion on it. So you've obviously done an undergrad, you've been to university. So I guess irrespective of you've been to university or not, there seems to be an ability to be able to come in. Do you think that that is something that more people should take advantage of?
Yes, I think that even, you know, I have a little bit of care experience. I would say basic nursing care experience. But I think, you know, the attitude really should be, why couldn't you do that? Why couldn't you come in and make a change in your life? Why couldn't you do something that you think, you know, we spend more time at work than we do with our own families. So why would you not want to do something that you think you would love every day?
That's
So
a really, really, yeah, a really, really good way to put it. And that's the thing. It's trying to find something not just as a job, it's something that you can actually have some passion for as well. So that's really, really interesting. And William, for yourself, I mean, we all obviously come into our professions in different ways. Obviously, nursing, there's a wide variety of potential students that come in. Obviously, Emily's mentioned that she's a mature student. What about yourself? What was your journey, and what attracted you specifically to coming into adult nursing?
Sure. I mean, my journey was not completely similar to Emily's. My career started off, I started nursing when I was 18. And again, sort of elderly grandparents felt that it was something that I had a bit of a calling for. You know, I do believe nursing is not a job, but it is something that you're meant to do. I started my nursing when I was 18, qualified when I was 21. Always had supposedly that sort of caring side, always liked to look after people, make sure that they were okay. And then joined nurse when I was 18, qualified when I was 21. And my career path has just got more and more clinical. I mean, I've always wanted to go down the career path of the clinical role. And I started my role out as a junior staff nurse on an acute medical ward, where I had gained a lot of sort of the core competencies of being a nurse. Always looked at more senior staff thinking I could absolutely never be like them. And eventually moved off the ward into a specialist role, completed a degree, then became a nurse prescriber, completed a postgrad, and very recently, well, 3 years ago, completed my master's in advanced nursing. So I do believe that it's more than just a job. It is absolutely a calling. And I mean, I've been nursing for over 20 years now, and I don't think that I could do anything different. I think it's
very good. So there's two different journeys. And what about yourself, William? What about your journey? How did you sort of decide that you were going to head down the route of adult nursing?
Well, I came out of school last year there. That's when I started nursing. So I came out of school, not much experience in healthcare. I still am a volunteer in St. John Ambulance. That was like the height of my experience in care. And it was always going to be something in healthcare for me. I always knew, well, my mum always said to me, you're a very caring person, why don't you become a nurse? So it always was going to be something in healthcare. And then adult nursing came up, and it really, really appealed to me. And that's because something that Monica touched on earlier was the fact that there's so much opportunity in this profession, which makes it so unique. There's so many different directions you can go. And I really, really wanted a profession that I could grow and develop in. So I'm now in my second year, and as someone who didn't have much experience in care coming into it, I must say that Queen's has been an amazing support through a very sort of practice-based learning experience. I've been in a wide variety of placements, from acute medical to cardiology. I've been in outpatient surgical, and all these placements have given me a wide range of skills in a very, very short amount of time. Mm-hmm. And I think that is what makes not only this university course and degree, but this profession so unique. And for me, again, sort of appealing to anyone who's thinks, oh, I don't have much experience, I need to get more experience to go into that. I would say to them, sort of, you just need to have the values of nursing. If you're a compassionate person, you're able to care for others. You don't necessarily need to have all the skills now. That's what university's for. That's what learning's for in the teaching environment. If you're a caring nursing and you're compassionate, I would appeal to anyone. This is the course for you.
Yeah, and I think that's it. I think that hopefully will resonate with people. It's a matter of, and I think there's a lot of misconceptions sometimes around what it is that an adult nurse maybe does on a day-to-day basis. And I guess that's why the next question is specifically that. And strategic, because by the sounds of things, it's a varied profession. It's a varied sort of path you can go on. But I guess, William Munday, you're obviously out there right now as we speak live. I guess I'm interested to understand, what does adult nursing look like on a day-to-day basis? Is there anything that's typical about it? Are there specific things that sort of get you sort of, up in the morning in terms of the actual day-to-day?
I mean, I think that as William had touched on, there's a variety of different clinical areas. So, a day-to-day is going to look a little bit different depending on what clinical area you're working on. But I mean, your core values of your trust and your caring and your compassionate is going to, that's going to flurry throughout any clinical area. I mean, your day is going to be assessing, monitoring, supporting patients, being an advocate for your patients. You're also going to be, you're administering your medications, performing thorough health assessments, your basic nursing care, so feeding your patients, looking after your patients, talking to your patients. For me, my background is, acute medicine, but I work in diabetes. So from my point of view, I enjoy communicating with people. I enjoy seeing an end goal. Hopefully that's a positive end goal with, facilitating discharge for patients and making that journey as positive and hopefully as memorable as possible. But I mean, nurses work incredibly hard. The program, the adult nursing program, equips a nurse for what is expected in the role of a nurse. But I mean, each day is going to differ a little bit. But as William had said, it's something that if you're compassionate enough about, it's something that you can absolutely you can fly with. It's an incredible career.
Yeah, and I guess to come back to what so William Somerville, you've mentioned this idea of the variety, the choice and stuff. Do you think that that's maybe part of the buzz of it, the day to day, that there's maybe the chance or the opportunity? Is that what you see in terms of being able to maybe nuance, to be able to focus on something as the years go by?
100%, yeah. I would say there's a lot of people that come into this course that I have talked to. They might come in with an idea of what they want to do, and then once they're at the end goal, 9 placements later, 3 years later, that could have completely changed because of that variety of what you can do. And that's what I think there is, like I said, a buzz about this profession. There's little sort of to no professions out there with the sheer sort of variety of specialties you can get into, and that's what really appealed to me. Like, for example, I've always wanted to get into acute care. I want to work in an emergency department whenever I qualify. But even in my own sort of experience in my placements, I've started questioning that when I got into cardiology. I guess it's very good. So I think there's a lot of, as you said, buzz. There's a lot of opportunity and there's a lot of excitement in the career. As I said, there's little to no other careers out there that will provide someone, whether they're coming in as a mature student, whether they're coming in just from school, whether they're coming in from work. There's little to no careers out there that can provide the same buzz, same opportunity, and same excitement as adult nursing, in my opinion.
That's great. And I think all of you have touched upon different aspects of, I guess, what you might consider what might make a good adult nurse. So let's say I have those qualities. I feel as if I've got, that ability to be able to empathize, to be able to communicate, to be an advocate for people, things like that. So maybe I'll point this towards Emily first, because you've obviously gone through the process a bit like William. What do you think an individual should concentrate on? What should they focus on when it comes to the application process? If I've already got some of those skills, I'm interested now in applying specifically for this discipline. What do you think are the things that you maybe focused on that would be beneficial for others?
I think whenever I was doing my application, the thing that I focused on the most was helping others who can't help themselves. Monica had said anybody that comes and uses our health service is a vulnerable person. And I think it's really, these people, our patients are looking for help. They're looking for our help. So I think, I really focused on that. I talked about during my application about how we need to focus on how to help people, and it's wanting to help and going that extra bit to help them. I think as well as a student nurse, there's limits to what we can do, but it's also knowing that we can do more for them. We can try and make them more comfortable in hospital. And I think communication is a big thing. Is another thing I focused on. Communicating with my experience with people with dementia, and how to really communicate with them in different ways, whether it be music therapy or, watching, it doesn't necessarily have to be a big deal. Just being in someone's company can make somebody feel more at ease. And I think it's important to think that, like, our patients are vulnerable and they need our help in whatever way. Sometimes that's just making them feel at ease. So that's something that I focused on in my application, was communication.
Very good, very good. And Monica, it was touched upon in this video around the idea of, well, there's no such thing as a general nurse. So I guess one of the things that maybe would be useful for those who are thinking about this is to maybe do a little bit of deep diving of some kind in terms of trying to understand, what is an adult nurse? Is this pathway suitable? Can you think of any particular approaches that maybe people should take in terms of maybe searching out that type of information?
Yeah, well, you can. There's lots of information on our website, which I'm sure you will signpost people to. I think but if you are applying, you've decided that adult nursing is for you. You need to be very clear about that in your application form. So really tell us about you. You obviously do not need to know a lot about nursing, but you tell us about you as a person. What are your experiences? What's your knowledge? What have you been studying? And when I say experience, not necessarily experience in healthcare. You've maybe been the captain of a team. You've maybe worked in retail. You've maybe worked in hospitality, and lots of those skills are transferable. So you're maybe really good at communicating because of that experience, or you understand teamwork. You should absolutely look a little bit further into the course. So have an understanding of this is a 50-50 program. You'll be expected to understand that and maybe have some idea about how you would cope with the pressures and the demands of both from the academic and the practical side. But many of you will be coming to us already having achieved that in your programs that you've undertaken pre-university. So, reflect on those skills. You've done lots. It's just sometimes difficult to articulate that or to put that onto paper. But absolutely everything should be included in your application form with a clear focus at the beginning of that you want to be an adult nurse, and draw, just as William and Emily have shared some of their, and Will as well, have shared some of their experiences. What was that light bulb moment that made you think I want to be an adult nurse? And share that on your form.
Very
We'll
good.
be delighted to have you.
Yeah. And again, it's obviously now with this process being face to face as well.
Yeah.
You're not there obviously to interrogate people or anything like that. Yeah, it's and as you've mentioned, this idea that you don't need to come in with any prior knowledge. That's the whole point. And I guess, William, the one thing, just maybe if we finish with yourself, because you're out there, you're you've gone through this process at some point. Looking back and reflecting on your own maybe application process back when you did this, can you think of anything that you might have wished to have done maybe slightly differently, or that you did really well in that application process that got you in?
I mean, like Monica had said, I had played sports, so I included that in the application. I didn't have any experience with healthcare other than sort of helping to care for family members as best that I could. I suppose I didn't have a lot of life experience back then, so I was just out of, having done my A-levels, still living with my parents. So all I was just putting on the application forms, as Monica had said, just trying to give a bit of an overview and map out what I had been doing to date, and hope that would get me through the application and get me through into the adult nursing program. And luckily enough, it had done. So, I mean, you put on the application to try and explain the type of person you are, what you're involved in, what you hope to achieve. And I did that, and I was successful, thankfully enough. And 21 years later, here we are.
There you go. Well, there you go. And 21 years later, you've obviously gone down a particular specialism path. So that's fantastic. And by the sounds of things, there's lots of specialist options available. So I guess for anybody who's interested, if you're somebody who's coming directly out of school, you've maybe been like Emily, you've already done some form of university course and you're interested, or you may be somebody who has been out of the educational process for a number of years and you fancy something new and you have some of those skills that were talked about and a passion for this, please do make sure that you, after watching this video, go on to our recruitment page and have a look through the information. If you're watching this via YouTube, you'll be able to see the information for our recruitment page directly in the description of the video. And if you're actually on the recruitment page, you'll be able to see some of the other videos for the disciplines and lots of other information, including frequently asked questions, things like that. If there's still not enough information there, you want more, please do reach out to the school and make direct contact, and we'll be able to give you the information that you need. But definitely make sure you go through and you apply, and if you have any questions, do get in touch. So I just want to finish up and say thank you so much to Monica Donovan, to Emily Sinclair, to William Munday, and to William Somerville. Thank you so much for taking the time and discussing what sounds like a really fun journey as a career.
Absolutely.